Dr. Elliott Schwartz with us. Dr. Schwartz, you have a very interesting story. You graduated from dental school in '74, and now you're back in school.
Yes.
Wow.
Oh.
How long have you been a dentist for then? I'm trying to do the math in
40,
my head.
49 years licensed.
So, Elliott, if you don't mind me, I'm trying to understand, the first 40 plus years weren't good enough. Now you got to go back to school.
No, they were great.
Oh, they were great. Okay,
but,
okay.
I'm very, project orientated, and with children's dentistry, one of the things I found is it doesn't matter how good you are, how well you give an injection, how painless you are. When you're finished, the child doesn't know what happened to them. They've got this sensation they've never felt before. They could bite their tongue, their lip, their cheek.
Yeah.
They start crying after the procedure's over, well, because you've entertained them. And I latched onto a low-level laser years ago that I read a Perio article that said can be used for pain control in children.
So hold on, that's low-level laser therapy. That's photobiomodulation, right?
Yes.
Right.
Can you dumb that down to my level, please?
That is using a red light, shine it on the gums of a patient, a child, because the roots are right at the cortical plate. It stops pain conduction for about 20 to 30 minutes. So you can do restorations, if you're quick enough.
Without LA.
Without local anesthetic.
Whoa.
Holy shit.
Whoa. Don't get the
game
kid
changer.
out of here. Does that work?
Yes.
Really?
I used it for 12 years.
Wow.
Can you remind me the name? I want to write this down. What's it called?
It's low-level laser therapy.
LLT, or photobiomodulation.
Modulation.
I've heard of this before. A company reached out to me and they say, Neki, you teach a lot of wisdom teeth. Use this laser.
For healing.
Yeah, for healing. And so I tried it, and I found I tried it on 2 patients, and they had crazy pain. And then they're like, well, how did you use it? I'm like, you never trained me how to use it. And then I was learning there's inhibitory, and then there's excitatory.
Yes.
And I know this stuff. Yeah. But how do you use it? How did you even get into this?
Because I do a lot of reading.
You do a lot of reading. Okay.
And I just picked up on this one thing. Jerry Ross, who was...
Oh, man, my homie Jerry. I met Jerry. Yeah.
So Jerry Ross, he was doing a lecture on it, so I talked to him and I said, well, I don't know anything about this. And I don't want to invest in something I don't know about. He says, here, I'll loan you out one. You try it for as long as you want, and if you like it, you'll buy it. If you don't want, bring it back to me. So I tried it. I said, wow, this thing works. The kids, I didn't give needles. The kids were happy afterwards. Instead of a droopy smile, they were like
That's
this.
where trauma starts, right? That's why people start hating the dentist.
Oh, totally.
As a kid.
So that's why there's no science there. Okay, it's almost impossible to do experaments, clinical studies on children.
Why?
Oh, the inhibit.
Because they can't give informed consent.
Yeah.
So
much red tape.
Yeah.
So how does any of the research get out there?
You have to get Research Ethics Board approval, which is very high for children. And nobody wants to do it. So I had to retire so I didn't have to be stuck in an office and worry about my office and worry about getting this REB through their approval.
Isn't it just frustrating, the fact that red tape can clog up that whole, new wave of innovation?
Oh,
I'll tell you, I'm not anti, evidence-based dentistry, because that's where, everything is headed now. But dentists have always been innovators. It's not that we did the science, we just observed things like nitrous oxide oxygen, sedation, anesthesia. Dentists, they observed something, at a comedy thing and said, hey, I can use this in my practice. There's no evidence. It's coming afterwards. So what we're doing with only evidence-based dentistry is we're blocking innovation in dentistry at the clinical level. We're saying, if you're a manufacturer, you do all the research, and then it'll be accepted. But even research done by a company can be biased, and you need somebody out there that's completely unbiased. I can't say I'm unbiased about this research because I know it works. At least I think it works, but I don't have the science.
Yeah.
So I'm going to try and get the science. At least the first science going. My sample is going to be about 35. That's not big enough to say this works on 90% of the population, but it'll be the first science that maybe other people will take up and say, hey, you got the REB done first.
What's the REB? What does that mean?
Research Ethics Board.
Oh, right. Okay, yeah.
So if you don't have that passed, you can't do any research in North America.
Wow.
Do you know George Christodoulou?
Yeah.
The ultimate guy?
Yeah.
So he has a company that basically takes medical records and is able to use them for research purposes. And imagine the utility to that, because we waste all this information. Not waste, but it's not utilized in the right way because it's just getting used as patient files for legal purposes. But imagine the scientific utility there if you just get the regulatory approval to use these files.
Yeah.
And now you can run these huge experiments with hundreds of thousands of people.
Absolutely.
Can you imagine?
Man. Elliott, can I ask you a question?
Yes.
What drives you? Because, okay, I'm 39 years old. Elliott, how old are you? Let's just be honest.
76.
76. I'm 39. I couldn't imagine going back to school.
Okay.
How are you doing this?
You have to go back to day one with me. When I was 5 years old, I was a brainwashed child. I'm going to be a dentist.
Ah, okay. Would you have it in your family?
No.
Okay.
A distant cousin was a dentist.
Okay.
And my mother said, you're going to be like your cousin David. Okay.
Yeah.
When I was 19 and I decided what I really want to do with my life, I decided I wanted to be a dentist. I like what I'm doing right now, sitting down and working.
Yeah.
I like working at this level, not at this level, and not underneath. My father and grandfather were plumbers, and they made sure I was not going to go into plumbing.
Yeah.
Okay, so they trained me not to do that.
And now you're the dental plumber.
Okay, I do plumbing too.
Manor.
They made sure I was an apprentice for my father, and I did not like it. One of the jobs he had is, I used to go to high school in the day. He said, have your supper, go to sleep, because you're coming to me on the job from 12 to 8 when the factory shuts down and we can do the maintenance. So I did that for a year. And I said, I don't like this shit.
Yeah, literally. Yeah.
Anyway.
That's a good one.
Anyway, so, fine. I want to be a dentist. Well, you got to have marks. I don't have great marks. Never did. Because I didn't know. I never thought I was smart. Okay, I'm going to work hard, but I'm not smart. Okay, I write the very, very first dental aptitude test. Never done before in Canada.
Oh, you were the first
time. We were the
Did they have the soap carving?
No, it was chalk carving.
Oh.
Okay. So I can't study for this. It's an aptitude test.
You got it or you don't.
Now you study, a month or two before. That's all you do.
Yeah.
So anyway, I wrote the first one, and I phoned up the faculty to get my results that I passed, and came back. You only stood second in the province.
Wait, what?
It was aptitude.
Second from the bottom?
Top.
No, second from the top.
I was number one. I
never
been number one.
Man, you know what? I feel the same way because second place, in my head, second place is always the first loser.
Yeah.
That's how I feel, right?
Yeah.
No. I'm just kidding. Yeah, that's good.
So, but I didn't get into dental school. My marks weren't good enough. It was
so you were second in the province.
But my marks weren't high enough.
Oh, my goodness.
It was a hurdle you had to jump. It didn't matter how high you jumped over it, as long as you got over this hurdle.
Yeah.
And it's the same thing with your marks, as long as you get over the marks. So I just kept pestering, kept applying and applying. After 4 tries, they let me in.
Really?
But I had worked as a Good Humor ice cream salesman over the years to get myself through school. So I've worked with kids for already 5 years.
Yeah.
I love working with kids. And I didn't say I love kids. I love working with kids.
Yeah.
And I said, you know what? I enjoy this. If I'm going to work for the rest of my life, my career, I want to enjoy it.
Yeah.
So I went back to school for pedo, and I had the support of my wife. She worked, and she let me get through my education.
What did she do?
She was a graphic artist. She worked for Record Club of America. Then she worked for, the big British department store.
Harrods.
What? No. They had branches in Canada. Anyway, so she worked for them.
Eaton's.
No, Eaton's.
Marks and Spencer's.
Marks and Sparks, yeah.
Yeah.
So she worked for them, doing their, advertising and stuff. And then I, graduated. I worked for North York Public Health. I worked in my own office that I set up. And you wanted to know about me, not about some of my philosophies, okay? So got through dental school, got through my specialty.
Specialty in pedo.
Yeah. But I was trained as a clinician, and I want to be the best possible.
Yeah.
And I've always strived to do as great a work for my patient as I possibly can. And that's what I built my reputation on. And that came from my grandfather. He said, Elliott, it doesn't matter what you do in life. As long as you do it well, you'll do well.
Yeah.
Okay? Concentrate on your work, not on how much money you can make.
Yeah.
And so that's how I practiced, and I flourished. I could have opened up satellite offices.
Yeah.
I said, no, people come to me if I build a name for myself.
That's exactly how I feel. I don't know how you can open up another office, have your name on the door, and you're not there.
And have staff
Yeah.
and everything else.
I share that philosophy with you.
So
yeah.
that's what I had my own office. I worked hard,
Yeah.
but I had to get back to dentistry.
Yeah.
So I got involved with organized dentistry. Back in the day, in the 80s, I was on the Board of Governors, and I was offered the presidency of the ODA, and I said, I'm not ready for this.
Yeah.
I've got a family that's growing. There's no way I can give that kind of time to organized dentistry.
Is that a one-year term, by the way?
It's a one-year term, but you have to go on the line, which is 4 years, and then one more is past president. So I couldn't give 5 years, of that kind of commitment.
And do people typically work during that period?
What?
Do people typically continue to work during
You
that
have
period?
to. If you've got an office, you've got to work too.
Yeah. I've
So
noticed
even
that in
Janine.
Ontario. In Alberta, we don't have any of this. Like, I noticed it's a different system in Ontario than it is in Alberta. Like,
Yeah.
there's no one wearing blue jackets in Alberta,
Yeah.
like growing this 5-year this line. So
Yeah.
it's very different. That's very interesting. Yeah.
So I turned that down, and I said, I'm going to watch my kids grow, and I took 10 years off from organized
love that.
dentistry and worked with my kids. Take my girls to Girl Scouts, take my son to Cubs,
Yeah.
the full thing right up. I became the president of the school administrative council at high school, because I always said, I did it in public school, you're doing it in high school.
Yeah.
And then once my son graduated, I was free again, and I went back to organized dentistry.
Really? But you were practicing the whole time, though.
Yeah.
Like, you were still. So
Yeah.
you were pedo office.
Pedo office solo practitioner.
Okay, Elliott, I'm just going to ask you right off the bat. How do you have the energy for children? Because I find working on pedo, there's no such thing as a day off, and the energy you have to bring to every appointment has to be high. You can't
It's
just.
in the DNA. You have to know that you can do it. And, like I run around all day, like I'm up and down,
Yeah.
but you know what? It's loving what you do and doing it well. That's what keeps you going. But you know what it also is why I love pedo? I take some children that have terrible teeth.
Yeah.
I had hospital privilege.
Yeah,
I
yeah.
was the last, pediatric dentist in the GTA to have hospital privileges, and it was at North York General. So I would take the worst cases, and whether they were on public assistance or not, I never turned a kid down, and I would get them healthy. But that wasn't my job. My job was not only get them healthy, but keep them healthy. And when you've taken a child that has terrible teeth at 4, 3, and then they graduate from your practice at 18, and they've never had a cavity since, you've done the job that you were supposed to.
Right?
Can I ask
Look
a
at
question
this
to
guy.
both you and Neki? Because both of you share the same sort of passion about dentistry, which doesn't really exist in like the younger cohort as much. And I'm wondering if that's just because my cohort, obviously, very early stage dentists and still in school, may not have developed that expertise yet to be passionate enough, or if you think it's a generational thing.
You know what? There's two things that I would say. One is you have to have a passion before you get in. I had the passion before I get in. But I'm finding that the younger students, now this is where I was going to segue, feel that they brought their degree and that they deserve to pass, even if they don't have the clinical abilities, that they will challenge the school and say, like, I was a demo. I used to do third year, and I found a few students that weren't up to minimum standards, and I refused to pass them. My supervisor said, you got to pass them.
Yeah, we don't want a lawsuit on our hands.
You got to pass them. And I said, I can't. If I put my name down on something, I stand behind it. I always have. You got to pass them. Just give them a bare pass. That's all I'm asking of you. I said, they need remedial, not a pass. And he said, you got to do it. And I said, no, I don't. I just quit. And I walked out the door.
Wait, what?
Because
Man, stand
you know
by your
what?
ethics. I love this guy, man.
You have to have ethics.
Yeah.
That you are there for the public good. You are you were given a license to practice, but it's to help people. And if you don't help them,
Yeah.
that's your first goal, not how much money you're going to make, that you're going to make a return on your investment in your dental. Look at, I am so upset about organized dentistry. The people on my board and around me that say, oh, you poor dental students, you're going to graduate with a $300,000 debt. Oh my God, how are you going to service that debt? You're going to have to work your ass off. You know what? I graduated with a $100,000 debt. I paid 18% on it.
Yeah.
The chances of associating were very small. There wasn't very many associates out there. The dental fees were so low, I could not even put food on the table. If my wife didn't work, we wouldn't have eaten. I wouldn't be practicing now. I'd be dead because there would be no food for me.
Yeah.
There was no money around. So with you guys graduating, you got a job available. You can make $120,000 your first year out.
Yeah.
I made $22,000 my first year out.
Yeah.
Servicing $100,000 debt.
At 18%.
At
interest.
18%.
And I bet you in
Lord.
real terms that 100,000 is higher than today's dollars.
Yeah.
Absolutely. And right now it's what, 6%? When I graduated it was 3,
Yeah.
right?
Yeah.
18%. Can you imagine getting a mortgage at 18%? Oh my goodness. I can't even imagine.
Wow.
That. That's
Yeah.
nuts.
What about you? Because you're passionate and you're, in sort of like the middle cohort. If I met the very young, you're in the middle.
Yeah.
How did you get the passion for it?
You know what? I've always had the energy of making the person beside me. I just wanted to learn about them. Like that's why I love doing this. I've never met Elliott before, but I already know he's my homie.
Yeah.
You can just tell
I love
his passion,
mentoring.
man.
I love mentoring.
Yeah.
I've mentored foreign dentists to get their license here without going back to school.
Yeah.
By being passionate about the profession, making them great, as good a dentists as they possibly can be by giving them training. And I honestly think that dentistry should be a little bit like medicine, where after you graduate, you're not getting enough clinical experience anymore. That you work with a dentist who knows how to mentor you, that has been trained in mentorship, and can show you the ropes. I had a great mentor when I graduated. He showed me things, how to do it, how to be ethical, be considerate of patients and that. And without that early mentorship, which forms your whole being afterwards and your scope. So,
But Elliott, how do you find a mentor? When I first graduated, I had the shittiest mentor.
I
man.
think that's the problem. Because dentists are trained to be mentors.
No.
And if you get into the wrong associateship, the guy's only interested in how much money you can make his practice.
And they put a quota on you.
Yeah.
They put a quota over your head. This is how much you're building. Yeah.
Private dentist that has an associate or, a dental corporation, some of them are only interested in profit. Corporations are only interested in profit. Some dentists are interested in helping you to develop your career. But this is something that the universities could take on and say, we don't want you to be able to go out on your own until you've had 1 year of a mentorship program where you might be under a salary. It might be, $50,000, $60,000, $70,000. Not what you could make at Dental Corps or anybody else, but at least you're going to get a proper mentorship because the person who takes you on has been trained like in medicine.
Absolutely.
You can't be, a mentor, in family practice without taking training on what you have to show that, new graduate.
Elliott, what is, at this current stage, you've seen this whole evolution of dentistry over the last several decades. What advice would you offer a new grad sitting right here today, graduating in 2023?
Be honest with yourself. Know who you are. Know that you are a dentist and you're a professional, and a professional has certain responsibilities to the population. It's not the college that tells you what your responsibilities are. It's in your heart what your responsibilities are. And you go out there and you do the best you can every day. Today, I could do so well. Tomorrow might not be as good as today, but it was the best I could do yesterday. And tomorrow I might do even better. Every day, I do the best that I can that day. And I can't do better than that, but I don't set my goal lower than what I can do best that day.
I'm still starstruck about what he said about medicine and how he related it to medicine. Because in dentistry, our mentors are completely transient. And as anyone who's had a mentor knows, it's not just the, do this, do that. It's, okay, what kind of person do I want to be? What kind of communicator do I want to be? And you can't get that from having these like quick touch points with a million different dentists. You need one person to teach you the ropes.
That wants to take an interest in your development, that wants you to get the best out of you as a professional. And I think that's where dentistry should be going.
Yeah.
Because we're seeing a lot of problems now with ethics, where a lot of complaints are coming with new graduates that have overreached their abilities.
Ooh.
Can you say that one more time?
Go ahead. Say that one more time.
Yeah. A lot of problems at the college, complaints, are young graduates that have overreached their abilities. Like, if you haven't done a 3-unit bridge in school, why are you attempting to do a 6-unit bridge now that you're out of school?
Absolutely. But this goes back to the Dunning-Kruger effect. You don't know what you don't know.
No.
As soon as you graduate, your ego is bigger than your clinical skill.
Yeah.
And you're like, I can do this, I can do that.
Yeah.
And then 3 years later,
You're
you find out
licensed
how
to
it
do
fails.
everything.
Yeah. But that's dangerous.
Yeah. Yes.
I always say, in dental school, you learn just enough not to kill someone. That's what you learn in dental school, okay? And then after dental school, that's when your education, unfortunately, the way that the system is, that's when it truly starts. And you can't exceed your abilities, but yet a lot of dentists get into trouble, exactly like you said. But then 10 years later, you're like, oh, maybe I don't know all this. I need to start learning. 15 years later, then you're scared because you're like, I really know I don't know anything.
I took a course yesterday on, interceptive orthodontics. Completely different than what I was taught.
What is that?
Interceptive orthodontics.
I don't know what that is.
Instead of starting a patient in orthodontics when they're 8, 9, 10, 12, 15 years old, you start at 3 years old. You look at them and their growth and development.
Yeah.
And I've always believed in that. I've always done it. But some of the newer techniques that I never knew about, I would like to be practicing again, go back to school and learn these techniques. But, it's just...
But they're not taught in school.
No.
Wow.
No. School is very conservative. They want to teach you what they consider as safe, but not cutting edge.
Hey, that's very true. Very true. So, man, I'm telling you, they're just teaching you how not to kill someone.
This conversation just unexpectedly blew my mind.
Yeah. Elliott, I want to be you when I'm at your stage of your career. I never want to stop learning, just like you.
But you know what? It makes your life fulfilling.
Yes, it gives you purpose.
Yes.
Absolutely. What would you say, Elliott, at your stage in your career, what is your purpose in life right now?
To make dentistry better for you than it was for me.
Wow.
I've always, I'm conservative yet radical. We go back to my first year in dentistry. The dress code was shirt and tie outside of the clinic.
Yeah.
And I said, this is ridiculous. There is no reason. Like, especially when you're in the dental laboratory and you've got that lathe going around, you could have gotten your tie caught in that lathe and choked.
Yeah.
Okay. I said, you can't do this. Oh no, these are the rules. So as class vice president, I went to Spadina Avenue, went to one of the jobbers who had the worst looking ties possible. He was willing to get rid of them for next to nothing. I paid 5 cents a tie, and 127 of us in our class, even the women, put on these Halucious ties. I still have mine in my cupboard. They were awful. But it was the dress code. They didn't say what kind of tie you had to
Yeah, you
wear.
had to wear a tie.
Next week they said ties are not necessary outside of the clinic.
Yeah. It's funny. There's always, no matter what stage, the student will always rebel against the school,
Yeah.
It's still happening today.
It's still happening today.
But you have to work within the rules.
Yeah. I love you, Elliott.
Or if you can't, you work within the rules, or you get into the power situation, you can change the rules.
Yeah.
That's why I'm on the board of the ODA.
I love it.
Yeah, I've
This
been
was such a
changing
great
things.
episode.
I love it.
What a good episode.
Yeah.
Yeah.
Elliott, thank you so much
Thank
for coming on. It
You're
was
welcome.
it was such a great combo.
Yeah.
I think every dentist needs to listen to this because we all have something to learn from an experienced fellow like yourself, man.
Well, I got my passion for dentistry, still do.
Yeah, I love it, man.
Yeah.
I love it.
Okay.
Thank you for
Thank
coming
you
on.
so much for coming on.
You're welcome.
Welcome to the Hi, I'm Neki. Is that a
What's up, man?
sweater?
Yeah, dude. Dude, it's the Hi, I'm Doctor sweater. Oh, dude, I see you got yours on too. Looking sharp, bro.
Dude, where'd you get yours from?
It was super easy, man. I just went on to our website, www.hiimdoctor.com. That's HIIMDR.com.
We have a website. We must be raking in cash from selling these sweaters.
Dude, we are killing it. I mean, if that includes losing money on every single sweater that we make, I think we're doing really well.
Yeah, Neki and I are donating all proceeds, which is zero, to charity because we are losing money.
I wonder if the charity will pay us. I think we got something here, man. Let's keep on keep on losing money on every sweater.
Alrighty, guys, go check us out, hiimdoctor.com.
We'll see ya.